Are
Go
you able
ahead.
to hear me?
Yes, we can
Okay,
hear you
great.
fine.
All right, great. Good morning, everyone. I apologize that and regret that I'm not there with you in person, and also that I don't have any slides for you, so you'll just listen to my disembodied voice and stare at hopefully something interesting in the room where you are. As was mentioned, I am the Deputy Director for the Office of Human Services Emergency Preparedness and Response within the Administration for Children and Families. Hopefully, many of you are familiar with the Administration for Children and Families. We are the entity within the U.S. Department of Health and Human Services that funds many of the programs such as temporary assistance for needy families or perhaps more famous Head Start. We also fund childcare, and essentially we exist to serve communities and families that are at crisis or live in crisis every day. My office has the interesting and peculiar mission of serving those families when there's a natural disaster and essentially working to translate emergency management to human services providers and human services to emergency managers. I also had the opportunity to be deployed in Sacramento and Butte County for roughly 6 weeks prior to stepping into this position for the California wildfires. So I have some firsthand experience there. It is really great that you guys are focusing on recovery because this many months after, we ACF, my office, we have roughly 35 people in the field today. We partner with FEMA when there is a Stafford Act disaster declaration, and one of the resources that we deploy is referred to as the Immediate Disaster Case Management Program. The intent of that program is to connect disaster survivors to resources, whether that's faith-based, non-governmental, state, local, and federal resources, helping individuals who in many cases have never engaged with the social services system and are suddenly faced with having to navigate 17, 20 plus different entities, agencies, organizations that may be providing various types of support, but understanding that these individuals and families are, going through trauma, and it's quite difficult to understand most of the rules and regulations that have been put in place during steady state by individuals back in DC or in other parts of the country who fortunately have not had to go through a disaster. So to date, our case managers, we have, again, roughly 35 people in the field still, and our operation started in March, and up until now, we've interacted with more than 6,282 survivors, connecting them to resources for food, housing, clothing, transportation, assisting them with understanding how to apply for FEMA individual assistance, how to understand and apply for the Small Business Administration's disaster loans as well. And in many cases, for the most targeted or individuals with the most acute cases, we create disaster recovery plans for those families so that they can identify milestones and where they want to be within a certain time frame after that. This disaster in particular, this wildfire, I think it really, for us within ACF and our partners across the Department of Health and Human Services and over at FEMA, it is very different perhaps than what we're familiar with when we respond and help states and communities recover from hurricanes. In those types of disasters, we tend to focus on the counties, parishes, et cetera, where landfall occurred, where there was storm surge, where there was wind. What's not often focused on as much is the impact to the host communities. So looking at Butte County and particularly Paradise, when you have that many individuals who are displaced, and then they suddenly, almost instantaneously or overnight, if you will, show up in a surrounding community, while the focus of, and it should be, but the focus of FEMA and many of our partners within the Army Corps of Engineers and Department of Transportation, et cetera, is initially going to be looking at the damage in Paradise. How do we clear and remove and dispose of this debris? How do we get the power back online? What do we do about these houses that have been destroyed? But recognizing those individuals who were displaced from Paradise are now in Chico, they're in Oroville, they're in other parts of Butte County, those social services providers in many cases, were not directly impacted in terms of infrastructure damage, if you will, but now they are faced with welcoming and receiving this influx of a population who prior to that disaster, they had not staffed for, they had not budgeted for, they had not planned for. So a lot of the support that we at the Administration for Children and Families are providing through all of our grants and through our regional staff, in addition to the disaster case management program, is looking at strategies and also encouraging our providers and our grantees to recognize that this is a long-term recovery effort, that this is their new normal. 6 months, 12 months, 18 months after the disaster, they have a new population that they now have to support, in addition to the population that was already there, and what are the challenges that they may be facing. And so that does require a lot of coordination. Fortunately, it hasn't been socialized as much as it needs to be, but there is the National Disaster Recovery Framework, and in California, the Health and Social Services Recovery Support Function is active. It's activated. It's been on the ground since roughly January of this year, and there are partners coordinating across ACF, across HHS, across USDA, recognizing that all of our social services programs, in many cases, often touch the same family. But unfortunately, and this is likely a result of how our programs were created and when they were created by differing legislations. So our statutory authorities are often different in terms of eligibility. And so we are starting to convene and actually coordinate across programs and across departments and agencies, recognizing again that it's one family that needs our support. Back to the immediate disaster case management program, the value of that program to a survivor is hopefully that as an individual family, they won't have to tell their story to 16, 20 different agencies, knock on 16 different doors to finally get to the right door at number 17. So our case managers, again, are helping them navigate that. They're being the buffer, if you will, between that survivor and their family and all of these agencies and all of these resources. They're connecting the pieces together and thinking strategically. So that's a huge value. It's not monetarily, if you will, but I think it's certainly reducing the trauma to survivors. It also, through this program that we're implementing, enables the county and the state to kind of take a breather, to step back and focus on the recovery, noting that they've got this program in the interim that's connecting people to FEMA's Transitional Sheltering Assistance Program, their direct housing program, programs that are being brought in by HUD, USDA, other parts of HHS. So it's a program that has kind of shifted over the course of this disaster. I think in other disasters, we would have been out sooner in some of the disaster recovery centers. We certainly have had some operational challenges, recognizing that people have been displaced and are living in various different varying living situations, whether they're living at campgrounds and RV parks, hotels, or doubling up with friends and relatives. And so the work to connect those individuals has been monumental, and it's ongoing. And then our next piece is, of course, ensuring that the county and the state are able to continue that work once we transition out, but also, again, to look at, to actually have the data go beyond numbers and not just report to you that we've seen 6,000 people, but to aggregate those needs and note that the majority or the highest percentage of the needs have been for food, clothing, housing, transportation, or that there have been multiple requests for waivers for a specific program, so that as we enter into the next fiscal year for the state, as well as the next fiscal year for the feds, that we can look at our steady state programs and their abilities to support the community. I'm sure many of you are watching the news and are aware of the bill that's recently passed the House and the Senate, and we'll see in terms of the supplemental appropriation that we receive. But in most disasters, we don't get a supplemental appropriation outside of the Katrinas and the Sandys and the Marias. So it really is incumbent upon us within ACF and across HHS to figure out how to fit our programs into the disaster as opposed to fitting the disaster into our programs. And so that's a lot of the work that my office does to negotiate that and have that conversation with emergency managers, with the community, and then with our program managers. I'll pause there, and if there are any questions.
Do we have any questions from the audience or our web audience? Yeah. Okay, let me hand you the mic. We have a question coming, Byron.
Good morning. Thank you for your presentation, Byron. My name is Barbara Hanna. I am the Executive Director for Caring Choices. We manage the Spontaneous Volunteer Center, and we're now involved in recovery. Some of the issues that you discussed in terms of just broadly looking at multiple programs and trying to fit disaster into the criteria of a certain federal program or state program, it cannot be overstated. Some of the other issues that we're seeing that I don't see on a broader leadership scale that I think needs to be addressed has to do with domestic violence, has to do with HIPAA concerns about patients or clients that have, let's say, HIV, mental health issues. We've been given certain types of software. CAN would be an example where we've adopted that, but there's limitations to these systems. And we are seeing increased domestic violence issues occur because of the stress involved. And what we're seeing as case managers has to do with if you've got a family together, husband, wife, there's domestic violence issues, they're tagged into that same case note. And therefore, if a wife is now protected someplace else, that husband can get access to where they're at. So there are these kinds of problems that we're seeing, and I'm not saying that, you know, this is horrible in terms of the effort that's being made, but it's been 10 years since Katrina. These kinds of things have continued. And I'd like to ask your opinion on how do we facilitate this leadership that needs to be there at these very concrete issues that need to be addressed, whether it's looking at, it's kind of like the electronic health record issues, you know, where we all have our electronic health records, but they're not talking to one another. And I know the sensitive nature of the stuff that we're discussing, but it's like, who's at the table? Who are we bringing to the table to talk about some of these broader issues so that we can have a vision, a strategic plan to move this forward and not just, you know, react to the crisis, but do some forward planning.
All right. Thank you, Barbara. I appreciate that question. I do share those concerns. I guess for background, for your awareness and other people in the room. So yes, we, human services partners at the federal level and really at any level of government, we have not, in many cases, been in the room or been at the table or had a voice. This is literally the 4th week that I've been in this position, and my director, I think she's been in her position for 7 months. We were hired in many respects specifically to address the gap that you just noted. So my office, the Office of Human Services Emergency Preparedness and Response, it was created after Hurricane Katrina. It never, unfortunately, truly fit in or stepped into the space of prioritizing human services. I think, you know, it's human services is a much more difficult thing to tackle than a damaged road or bridge that you can see and can have a beginning and an end date to the project. And some of the challenge I think that we've seen has been a lack of really, whether it's external or internally within human services, to translate the emergency management language, if you will, and the priorities, and to do the reverse of human services back to emergency management. So in the almost 4 months that I've been here, we've been having a lot of conversations with FEMA. They share your concerns and my concerns. They're eager to see us step into that space and to start start building out those relationships. I'm pretty sure you're probably familiar with the National Response Framework and the emergency support functions. And if you've seen disaster operations around the nation, you'll note that even though on paper it says emergency support function 6 is about sheltering, mass care, and human services, operationally it focuses solely on sheltering and mass care. So my office, the work that we are doing and will be doing going forward is to actually step up and highlight the human services part of that emergency support function. Again, we've had conversations with FEMA, we've had conversations with Save the Children and Child Care Aware and the National VOAD, and we will be reaching out. I think you will be seeing a lot more in the near future to address that, to have a national strategy to bring those partners together and even to connect. So my office implements the Immediate Disaster Case Management Program. Another part of the U.S. Department of Health and Human Services, SAMHSA, the Substance Abuse and Mental Health Services Administration, administers the Crisis Counseling and Technical Assistance Program after a disaster. So we have two programs that are essentially addressing the same group of survivors and recognizing that just as we recognize or are starting to recognize and accept that individuals who've been displaced and have medical needs, have human services needs, those same individuals often have behavioral health needs with trauma. So we are starting to coordinate. I think you will see that more in the future and we will publicize it, but it has not been done in a systematic and most effective way in the past.
Thank you, Byron. We are going to now move to our next speaker. We will have time for more questions and comments for Byron and for the rest of the speakers at the end. Next, I turn the speaker over to Annie Schmidt.